It's been 6 months since new laws took effect limiting your number of opioid prescriptions. But as News Channel 5's Matthew Torres reports, it's still not so easy for patients to accept.
My nurse came this morning and she said, "Put your oxygen on."
If it's not the oxygen machine or the face mask,
I put the mask over my face and inhale the medicine.
or the boxes and boxes of medicine,
I have plenty of what I need.
then it's simply listening to Greta Fields. To know pushing through daily life isn't so easy.
It's a smothering feeling. It's very frightening to live with this.
The 60-year-old has reactive airway disease as a result of battling lung cancer. Difficulty breathing sometimes is paired with extreme coughing, so she uses this liquid form of hydrocodone to treat it.
When you cough, your ribs hurt, your head hurt. I broke 2 ribs.
But last week, her recent prescription came as a shock.
I was totally blown away. What in the world is going on?
The bottle was smaller than usual. It was her first prescription since the new opioid laws restricting supply to 3 days took effect in July.
The idea behind the law is to prevent people from inadvertently getting dependent on these medications.
There are several exceptions to the law, but Fields doesn't meet the requirement. She may have a chronic disease, but she only uses the opioid when needed.
Once I get settled, then I'm okay. I don't need the hydrocodone. But my issue is I won't have it if I need it.
She's had to resort to older medicine to avoid more hospital visits since she can't go to many places.
I feel that a huge overcorrection has happened.
Fields believes in preventing opioid abuse, but for now she feels she's the one left in a gray area.
You put this on and you go, oh, yes.
Matthew Torres, News Channel 5.
After completing a 3-day prescription, a patient must be reevaluated before receiving an opioid. The state says the risk of staying on opioids increases after 3 days if you're not a frequent user.